A hearty good afternoon and welcome to the session on bleeding during pregnancy. We are glad to have Dr. Vimla among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Yeah. Thank you for the introduction. Myself, Dr. Vimla, obstetrician and consultant in Apollo Cradle, Brookfield, Bangalore. Today I'm going to talk about bleeding during early pregnancy. How common it is, whether it is normal or abnormal, whether it is the sign of miscarriage, what to do next. So, going into the topic, bleeding during early pregnancy is common. 1 in 4 women usually have bleeding during early pregnancy. That is almost like 25%. Not necessarily every time they have the bleeding during pregnancy that it is abnormal. Most of them will be having a healthy pregnancy, even though they have bleeding or spotting during the early pregnancy. But we cannot neglect bleeding. Why? Because there are some other causes like miscarriages or ectopic pregnancy or molar pregnancies, which I'll be dealing with now. Okay, these also have bleeding during the early pregnancy. So if any signs or symptoms of bleeding or spotting during the early pregnancy is there, immediately you'll have to meet your doctor. So, what are the causes and what are the normal causes? Usually, the normal cause for bleeding during early pregnancy is implantation bleeding. Implantation means when the fertilized egg, the egg and the sperm meet in the fallopian tube and fertilization occurs, and this fertilized egg comes and settles down inside the uterus. During this procedure, there can be mild spotting or bleeding, and it usually will be either brown color discharge with white mixed in it or very minimal spotting. Spotting means it is only a few drops of blood, not the proper flow of the blood. And in case if this is seen, then you have to meet your doctor so that she'll be able to do some blood tests and the scan to see whether it is a normal or an abnormal bleeding. And most of the women who are having this kind of implantation bleeding, the pregnancy will be healthier and need not worry at all if they are having this kind of bleeding. The second one, which is the early sign for miscarriage, is bleeding during pregnancy. 1 in 15 women usually have this kind of bleeding and they land up in miscarriages. This is again of two types. It's a threatened one or inevitable. Threatened means where the heartbeat will be good in the scan, the cervix will be closed, and they'll be having a mild spotting or bleeding, sometimes associated with or without abdominal cramps. In this case, usually the pregnancy will be healthy and it will go on very well with few precautions and hormonal supplements. If it is inevitable, that means the cervix is already open and sometimes there is no heartbeat for the baby, and the patients start passing tissues along with the bleeding. These women usually have heavy flow with abdominal cramps as well associated with clots. This kind of inevitable miscarriages cannot be prevented, and there is no treatment as such for these other than allowing it to naturally go off into spontaneous abortions. Coming to subchorionic hematomas or subchorionic hemorrhages. Nowadays, we see a lot of subchorionic hemorrhages in the scans. It can vary from mild to moderate. Like mild means very small subchorionic hemorrhage. These hemorrhages means it usually will be between the sac and the uterine wall. And mild ones like mild bleeding usually will not have any impact on the baby and the pregnancy will be healthy. Larger with some hormonal supplements as well. But the larger ones usually will cause either miscarriages or late miscarriages or placental abruption in the later pregnancy. Placental abruption means they cause the placenta to separate from its site in the uterus. All these are dangerous causes and they can mostly land up in miscarriage. Coming to ectopic pregnancy. So, what is ectopic pregnancy? Ectopic pregnancy means, like I told you, egg and sperm meets in the fallopian tube and comes and settles down inside the uterus. But in ectopic pregnancy, because of some conditions like infection or inflammation of the tube, the fertilized egg will not be able to come and settle inside the uterus. As such, it starts growing inside the tube or sometimes in the ovary or other parts of the abdomen. In these cases, if it is diagnosed very early, when they are having only mild spotting, it will be easy for us to treat. In later cases, when it starts growing inside the tube, it starts rupturing the fallopian tube. That usually is a life danger for a woman. And these women not only present with bleeding during pregnancy, they also have severe abdomen cramps, sometimes not tolerable. It can be located on either side of the iliac fossa, which means in the lower part of the abdomen towards the right or the left hand side, on the side where the fallopian tube is involved. And these women even have fainting spells. Coming to vesicular mole or molar pregnancy, which is the next one for causing bleeding during the early pregnancy. Vesicular mole means it's an abnormal placental tissue because of the genetic error. It can be like a partial or a complete. Complete means fertilized by a single sperm, and partial means fertilized by two sperms. And this kind of abnormal pregnancy is very, very rare but serious condition. This is seen in 1 in 1000 pregnancies. And this kind of vesicular pregnancies or the molar pregnancies, they are usually diagnosed with very, very high beta HCGs, or in the scans where we can diagnose that it is a partial or a complete mole. Or sometimes they start bleeding, and after the DNC, that means the cleaning procedure is over, looking at the tissue, we'll be able to diagnose it that it is a vesicular mole or a molar pregnancy. And these women not only present with lower abdomen cramps, they have very, very high BP in the early pregnancy, and excessive vomitings will be seen in them. So, other causes which are not related directly to the pregnancy but can cause bleeding during the early pregnancy are like cervical changes. During the pregnancy, because of the hormones, there'll be increased blood flow to the cervix, and the cervix will become very soft. So normal exercises, which can be like a little bit more like a brisk walking in the early pregnancy, or if they are traveling in the early pregnancy or having intercourse in the early pregnancy, can sometimes lead to bleeding because of these cervical changes as well. And then comes the infections of the cervix. This also is not directly related to the pregnancy part, but infections of the cervix, like infections of the pelvic area, infections of the urinary infections, or vaginal discharges, all this can also cause indirectly bleeding during the pregnancy. These women present with not only the bleeding but white discharge or urinary infection symptoms like burning in the urine, increased frequency of urine, sometimes lower abdomen cramps and backache, and itching in the vulval areas, and sometimes sore or soreness or some pimples kind of thing in the vulval areas. So, what to do if you're having bleeding in the early pregnancy? See, do not neglect, like I told you, it can be common and normal also, but there are other causes also which have to be ruled out immediately and at the earliest. You have to contact your doctor, and she may ask you a few symptoms and examine you. She might ask you the amount of bleed, whether it is a spotting or a bleed. Spotting is nothing but few drops of bleeding, or the brownish discharge, and the bleeding is proper where it will even stain your panties. And whether it is associated with any clots, any fainting spells are there, or if you're having severe pain abdomen, all this she will ask you, and then she will advise you some blood tests like serum beta hcg to rule out whether it is a normal pregnancy or an abnormal pregnancy. And then she will advise you ultrasound scan. In ultrasound, we get to know whether the heartbeat of the baby is good or not, and whether the sac is located in the correct position. That means we are ruling out ectopics. And to look for any subchorionic hemorrhages, that means the blood clot between the sac and the uterine wall. and to look for the placental positions like later on in the pregnancy. And if the heartbeat is good in the scan and the cervix is closed, your doctor will advise you to take some hormonal supplements and progesterone supplements so that the bleeding will not only stop but it will give good supports for the pregnancy. And she will advise you to be in bed rest. Bed rest doesn't mean sticking onto the bed, but it means limiting some activities and reducing the strenuous work. And she will also advise you not to have intercourse and go for long travels. Then if the heartbeat is not there or the cervix has already been opened like an inevitable miscarriages, this is the one where we cannot prevent the miscarriage from going on. And if it doesn't mean that if they had miscarriage in this pregnancy they should be having miscarriage in the next pregnancies. Usually if they, even if they are having miscarriage now, the next pregnancies would be a healthy one. And coming to ectopic pregnancy, like I told you, in the early stages, if we are diagnosing the pregnancy when they have only a mild spot or mild bleeding or minimal abdomen pain, then we will be able to save the fallopian tube of the women. Here in these cases, we have to look for the sac size and also whether the heartbeat is formed or not. When the sac size is small and the heartbeat is not yet seen, then there are injections where we can avoid surgeries, and with the help of injections, this can be treated. But if they are coming in the later part with severe abdomen cramps and the fallopian tube has already been ruptured, then there is no point of giving the injections. We have to go for a surgical procedure where one of the tube where the fertilized egg is growing has to be removed. And these people might also require blood transfusions, and sometimes it might be a cost of a life also if it is delayed. Then comes infections. Like if it is infections of the cervix and all, we just give antibiotics which are completely safe during the pregnancy and the bleeding can be stopped. In case of vesicular mole or a molar pregnancy, usually it will be a DNC procedure, and sometimes later follow-ups with frequent beta HCG values and frequent scans are also involved in those cases. And in subchorionic hemorrhage, if it is a milder one, we'll put you on some progesterone supplements in the form of tablets or injections, and also advise you like being in bed rest, no travel, no intercourse, and avoid the strenuous activities. So, to conclude, bleeding in pregnancy is common, seen in 1 in 4, that means 25% of the women, and it is not always abnormal. It can be seen in normal conditions like implantation bleeding also, but never to neglect bleeding in pregnancy, because there are some underlying causes also like miscarriages, ectopic pregnancy, vesicular mole, which can be dangerous to the life of the individual as well if not treated at the correct time. So, anytime if you're having bleeding during the early pregnancy, meet your gynec immediately. Thank you, one and all. If you all are having any questions, you can post me in my private chat. I'll get in touch with you and reply you. Thank you.